If you have been feeling sore, tight, or just not like yourself after C-section, you are not alone. That feeling of numbness, irritation, and burning around your incision, constant heaviness in the lower belly, stiffness when you move, that is all common, but it does not mean that that is something you have to live with rest of your life. In today's video, I am sharing 5 simple things you can start doing immediately, even if you're just a few days or weeks out for C-section surgery, that will help support your healing journey and make you feel better so you can manage your pain and discomfort effectively in just a few minutes a day. Hi mamas, and welcome back to my channel. If you're new here, hi, my name is Shredi and I'm a board certified physical therapist helping postpartum moms just like you regain their core strength, heal their pelvic floor, and feel energized all in 15 minutes a day. So let's get started with today's video where I'm sharing 5 simple ways to manage your pain and discomfort after a C-section surgery. Now, tip number 1 is using ice packs or heating bags to help you with pain. If you have been noticing a lot of pain in the lower back or your lower belly area around the incision, using the ice packs or heating pads would help in improving your circulation in those areas, relaxing your muscles, and hence decreasing the pain. Now, when to use the ice packs or heating bags? So depending on how many days out you are after the surgery, if you are about 7 to 10 days out of surgery, start with ice packs because right after the surgery, there will be a lot of swelling that you would notice around the incision. So the ice packs would help in reducing the incision, numbing the area, hence decreasing your pain. However, once you are past the 10 days or 2-week mark, you can start using the heating bags. Heating bags will help in improving the blood circulation in that area and relaxes those muscles. That way you don't feel a constant tightness, pulling sensation, and it will reduce the pain. So depending on how many days you are out, start with either the ice packs or the heating bags to help manage your pain effectively. Now moving on to second tip and the most important one, which is gentle core breathing. What this means is really focusing on how you are breathing. I know how simple this sounds, but during the 9 months of pregnancy, due to all the postural changes that happens, your breathing pattern gets changed. It is affected because of the constant downward pressure on your belly and the pelvic floor muscles. The way you breathe is not very effective. So one of the first things we want to focus on during the postpartum recovery period is how you breathe. Think about taking in a deep breath through the nose, count to 4, you hold the breath for another 4 seconds, and then you breathe out through the mouth for 6 seconds. And you can do this 1 or 2 minutes at a time, or you can do this for 5 minutes. If you're doing it for a couple of minutes, maybe do it 3 times a day. But the whole focus here is having one hand on the chest, one on the belly, and when you breathe in, all the air should go in the belly, lower belly area, keeping the chest nice and relaxed. What this does is, of course, it improves the circulation, but it also helps in relaxing the muscles in your abdominal area, your core muscles. Hence, it also improves the connection between your core muscles and the pelvic floor muscles, which is really important. After this major surgery, there is a lot of disconnection between the muscles. So deep core breathing not only relaxes your muscles and restores the breathing pattern, it helps in rebuilding the connection between your core and pelvic floor muscles. So the second thing you want to start focusing on is your deep core breathing. This can be as little as 2 minutes a day, or if you are up for it, try to do it 2 minutes at a time, but 3 or 4 times a day. And you can do this in any position. To start off, if you do it lying down, it will be a lot easier because you can feel the muscle movement. But you can also do this in sitting if you're bottle feeding or feeding your little one. If you're sitting on the bed or a chair, just try to practice breathing at the same time, where you're taking deep breaths in through the nose and then out through the mouth. Now let's move on to tip number 3, that is using pillows for better postural support. So anywhere you go, you should have at least one pillow with you. The reason you want to use pillows is your muscles are still weak. They are not strong enough. Your core is weak, your low back muscles are weak, your posture is affected. And on top of that, you're constantly feeding, diaper changing, getting your baby up. So your body is always hunched forward, your shoulders get rounded, your head is down. So this puts a lot of downward pressure again on your belly and pelvic floor, and we do not want that. So using a pillow, when you're holding your little one, having a pillow under is going to help upright your posture, because now you are supported with that pillow. That way you're not hunching over. Or think about if you're sitting in a chair or leaning back on the bed, have a pillow in that low back area. Because of the arch, your core muscles are getting extra work because you're not supported well. But if you put a pillow in the low back area, now you are supporting your muscles and reducing unnecessary tension on them. Even have one pillow in the bathroom. So when you are trying to ease back into bowel movements after your surgery, you might find it super painful when you're trying to pass the bowel movement. So having a pillow nearby and putting the pillow, take a deep breath in, and then as you exhale, support that incision with the pillow and then try to do a bowel movement. It's going to make it a lot easier on your incision side without unnecessary pulling or tightness or pain in that area. Now moving on to tip number 4 is gentle scar massage. So this is one of the things not every mom has heard about it, and it gets skipped in postpartum C-section recovery. A lot of times moms are just told by their doctors, with time your scar will heal, don't worry about it, and you just forget about that incision. Though it's painful, though it's irritating, though it's burning, we don't worry about it. We just focus on rest of the things and the scar gets totally sidetracked. But scar massage is one of the important things to be included when we think about C-section recovery. And you can start doing this as early as about 4 to 5 weeks after your surgery. So now at 4 to 5 week mark, your incision is not healed completely. So you might notice that it is still really tender and painful to touch. So we don't want to directly touch the incision, but we want to focus on the skin above and below the incision. Because here's what's happening inside the skin. All you can see outside is this thin incision line, but there is a lot more that goes inside the skin. Because of that incision line, now we have scar tissue that is forming underneath the skin. And that scar tissue is not just one small line. That scar tissue is crisscross adhesion patterns that goes above and below the incision too. So now there is a lot of tightness internally. That scar tissue starts hardening, becomes adhesions. So now that you move around, you're trying to bend, you try to lift things, it gets really painful because of these adhesions inside the skin, which you cannot see, but they still exist. That's why focusing on mobilizing the skin early on is going to prevent these adhesions from forming, and that way your movements will feel a lot more smoother without unnecessary tension or tightness. And now after 6 to 8 weeks, once your incision is healed, that's when you will slowly start mobilizing the actual incision line. But before that, we can work on massaging the skin on top and bottom of that incision. That way we are still mobilizing, improving the circulation, preventing those adhesions from forming. Now moving on to our last tip, tip number 5 is start walking as soon as you can. I know this sounds contrary to what you might have heard, is try to rest more, try to take things easy, and I'm all for it. Don't get me wrong, rest is super important and you want to rest, take naps, take it slowly. But walking is one of the best ways to heal after C-section recovery because it is a full body movement where it helps in improving your circulation. It helps in supporting and activating your core muscles. It's improving blood circulation to the ankles. It is improving your muscle movement, muscle function. Now, when I say walking, I'm not saying that you have to go outside and do 1 mile walk, get on a trail and go for a 30-minute walk. Walking can be as simple as if you are in the hospital still after a few days of the surgery, walking from your bed to the bathroom 3 times a day. The goal is to get out of the bed and just do gentle movement so your body doesn't get stiff. You don't want your joints stiffening up, your muscles getting tight. So if you feel up for it, again, if you are weak and you need to rest, you have to prioritize resting. But if you start feeling a little better and you think you can go to the bathroom, try to walk 3 times a day from the bed to the bathroom. Once you come home, maybe start walking from your bedroom to the living room. Even though you have everything in your bedroom, even once a day, make it a habit to get out of the room and walk to the living room, to the kitchen. And then as you start feeling stronger, start making loops around your house or apartment. And this could be just for 1 minute, 2 minutes, 5 minutes, 10 minutes. So you're slowly building up the endurance. You're not doing any exercises, physical stressful things, but just walking around the house is a great exercise in itself, which is going to promote the muscle and tissue healing, improving blood circulation, activating your core muscles, but it also supports indigestion. So if you have been feeling gassy, bloated, walking is a great way to get things moving, and it will help you in having better bowel movements every day. So let's recap all the 5 tips that you can start implementing right away to help with your pain and discomfort after C-section. So the first one is using ice packs or heating bags to manage your pain effectively. Then second one is doing deep core breathing so you can improve your core pelvic floor muscle connection. Then third one is using pillows for extra support. This could be supporting your low back, supporting your upper back when you're feeding, or supporting your incision when you're trying to have a bowel movement. Then fourth is scar massage. You do not want to forget your incision. Start being proactive around that incision area and prevent the adhesions from forming. And then the last but not most important is walking. Walking is a really great exercise, not just for your muscles, but it also helps with digestion. So small walks just from the bed to the bathroom, from the bedroom to the living room is more than enough. But just staying active, keeping your muscles active is going to improve that blood circulation. Now, from these 5 tips, I want you to pick 1 or maybe 2 things that you want to focus on, depending on what you are struggling with the most. If pain is the biggest concern right now, let's focus on the ice packs or heating pads. Maybe if stiffness is a concern right now, depending on how many weeks you are out, start with core breathing exercises because it is going to relax the core muscles, and then maybe add walking if you feel up for it. So just pick 1 or 2 things from these 5 things and start doing them every single day, and you will start seeing a difference. You will notice that your healing journey is getting easier, a lot more smoother. You're feeling better. And then once you get in a habit, add 1 more and then 1 more. So we want to build 1 on top of the other. We don't want to start with all 5, feel exhausted and not think about it again. Pick 1 or 2 things, and then eventually as you start getting comfortable, things start feeling better, we'll add 1 more, 1 more, 1 more. Now, if you found this video helpful, do me a favor and hit that subscribe button below if you haven't already. That way you are always updated when I post a postpartum tip on this channel. But also, if you want to dive deeper and get a clear step-by-step plan for you to follow, I highly encourage you to go ahead and sign up for my free 5-day momentum challenge, where every single day for the 5 days you will get a postpartum exercise workout from me, exactly what we talked about, how to ease in, and also a recipe, because nutrition is equally important. What you eat is important in these crucial postpartum recovery days. So having a nutrition meal plan recipe guide that tells you what to eat, what foods is helping you right now, will be a game changer. So go ahead and sign up for the free 5-day momentum challenge, and I will see you next week. Bye, mamas.